Taking a sexual history with older adults. Let's start with the background. Sexual health is an integral part of overall health across the lifespan, and research supports that many older adults continue to be sexually active throughout all decades of life. Older adults are more likely to have limited knowledge about STIs and HIV. And older adults are more vulnerable to transmission and sometimes are diagnosed late due to the provider's lack of knowledge concerning their risk. 17% of newly diagnosed HIV infection in Americans are in the 50 and older group. So what is the need? HIV and STI prevention and control guidelines, they require comprehensive sexual history for all adults. All adults should be advised about risk and risk reduction. And sexual health discussions between clinicians and older adults are suboptimal. The sexual history should be incorporated as a routine part of the medical history. And effective interventions are necessary to increase screening and testing for older adults. Let's discuss some sexual history taking practices. Understanding about how older adults and healthcare providers engage in dialogue about sexual health is limited, and most studies regarding sexual history taking have relied on self-report measures and chart reviews. One study explored the content and context of physician-patient sexual health discussions during periodic health exams. To answer two questions, they looked at what frequency are components of sexual history taking addressed, and also what patient, physician, and visit factors contributed to sexual history taking. And they transcribed audio recordings of 483 periodic health exams. They analyzed them with permission from the patients. And the analysis revealed that approximately one-half of the PHEs included some discussion about sexual health, with physicians initiating that, but only 10% of patients were specifically asked if they were sexually active. And the most frequent health topic discussed was history of abnormal pap smears, and the second topic was sexual performance. Another study looked at nurse practitioners' sexual history taking with adults over the age of 50. And the study involved a random sample of 500 American Academy of Nurse Practitioner members using a mailed questionnaire. And only 2% of respondents indicated they always conduct a sexual history, while 23.4% never or seldom do such an assessment. What are some of the provider barriers? There are misconceptions, inadequate training of providers, limited communication skills, insufficient knowledge about sexual health, the lack of preventive discussion about sex, time constraints, and there are personal factors such as age and gender. The main patient barriers are the reluctance due to embarrassment, having a younger caregiver doing the assessment, and the opposite gender. So the goals of sexual history taking, we want to reduce the risk of transmission of STIs and HIV in older adults. We want to improve the provider's comfort level in obtaining a sexual history, and also to increase early diagnosis and linkage to care. A few tips. Consider the don't ask, don't tell attitude exhibited by some older adults. If the provider doesn't ask, I won't tell. And if I don't tell, they won't ask. Establish rapport. Pay attention to verbal and nonverbal cues in older adults. Engage the patient. Maintain your eye contact and avoid rushing and interrupting. Use frequent, brief, affirmative responses. Maintain an open mind and an accepting attitude. The attitude of a medical professional has a powerful impact on the sexual attitudes and behaviors of older adults and their level of comfort. Never make assumptions about the patient's sexual orientation. Here are a few dialogue examples. You can use these or you can change them accordingly. As part of your physical, I will ask you questions about your sexuality. I take this history for all my patients to understand their sexual health and risks for sexually transmitted diseases and to provide complete and appropriate care. All information will remain strictly confidential. Another example of how to start. I'm going to ask you a few questions about your sexual health and sexual practices. I understand that these questions are very personal, but they are important to your overall health. And another example. I ask these questions of all my adult patients regardless of age, gender, or marital status. And these questions are as important as the questions about other areas of your physical and mental health. Like the rest of our visits, this information is kept in strict confidence. Do you have any questions before we get started? Here are some sexual history taking methods. Ask the patient if they are sexually active, their last sexual encounter, the gender of their current partner or the partner of the last sexual encounter, the number of current partners in the past 6 months, type of sexual behaviors, anal, vaginal, or oral, and sometimes you may have to be specific and name the anatomical part like penis, vagina, or rectum, condom use, or issues with sexual well-being, discomfort, erectile dysfunction. Assess and enhance the patient's knowledge of safer sex practices. In summary, healthcare providers are in an optimal position to help address sexual risk by doing comprehensive assessments and providing sexual health information. Healthcare providers should increase self-efficacy for addressing sexual health. Older adults should be empowered to seek information from their healthcare providers, and routine testing should be included for all adults. Here are references for your use.